10 years for healthcare and AI will look like?
In 10 years, we are going to see a huge transformation. Healthcare is definitely going to become more accessible.
Which branches do you think which will have the maximum impact on them in the next 10 years?
Medicine is going to boom significantly.
Medical AI prompt engineer. Now this is one of the most effective fields. How do you think a medico can enter into this particular specialization?
Prompt engineering is going to be one of the most important skill sets.
AI literacy versus AI fluency versus AI design skills. Which one do you think is the most important for doctors, nurses, paramedical people, everyone? Which branch do you think in the upcoming 10 years will lose the maximum number of residency seats because of AI?
The medical branches and the diagnostic branches.
What would your advice be to a new NEET-PG rank 1 thinking about choosing radiology?
Don't take radiology. It is...
We are building India's largest community of medicos, and thank you, each one of you, for making this a possibility. As usual, I'm going to first put up my message. Guys, if you're facing any kind of problem with your college, university authorities, you just have to make a post and tag me on Instagram. I will tag all the relevant authorities and I will take that brand for you. Doctors need justice. Doctors need fair working environment, and together we can achieve that. So today's podcast is all about artificial intelligence. The thing that is bothering each one of us, whether in next 10 years, doctors will be redundant or not. And we have got our very own AI medico specialist. He's a radiologist from AIIMS. He is a gold medalist from JIPMER and MD Radiology from AIIMS. He is a radiologist and a person who is passionate about AI. He focuses on agentic frameworks, multimodal models for diagnosis, and bias mitigation in AI. He has collaborated with the top institutes of the world: Harvard, Stanford, IITs, Rutgers. He is a winner under MIT COVID Challenge, and he has been a part of 30 under 30 Young Changemakers of India. He is also an advisor to a lot of tech startups and healthcare startups. He is my dear friend. Let's put our hands together and let's welcome Dr. Suvrankar Datta. Welcome, Dr. Suvrankar, to the Nachiket Bhatia Show.
Thank you. Thank you for having me here.
Suvrankar, you are one of the very few people, very few doctors, who have excelled in the field of AI, who know more than the word artificial intelligence. Suvrankar, you are here to basically guide all the audience that AI is here to help us, not to replace us. It might be the other way, but we need to know the truth from you. So before we get into that, I would like to know your journey. How did you get into the field of medicine, and when did you transition from being a doctor to an AI specialist now?
Thank you for the kind words. I think I would probably put myself as a clinician who is actively using AI and researching in AI more than AI specialist, like your term. I started working in AI in 2017 when I was a MBBS student at JIPMER. It was before it became kind of like very cool and very interesting field with a lot of interest. People hardly knew what data science is. We worked with IIT Madras. We built our own algorithms. We won one of the very prestigious challenges in the Indian Innovation Growth Program. And that actually gave me a initial exposure to how AI can actually transform the entire healthcare paradigm as we know today. I wanted to do residency in the US. So I had written my USMLA steps. I had prepared for the interviews and everything. But when I went to the US, I saw that the impact which I could make in India if I was involved in AI development, validation, and anything where I can actually bring AI to the billion people of the country and make healthcare AI accessible to everyone, that would be much more than me just being a resident in some state in the United States. So I came back to India. I was very clear that I wanted to do radiology. I was lucky to join the All India Institute. There I got a huge amount of support from all my faculty, my HOD. We went ahead. My MD thesis was in the development of an AI algorithm which is India's first from the academia side to develop, and also one of the world's first algorithms which can prognosticate patients in addition to just giving you the report. That was the first proper exposure where I got to work with engineers with multidisciplinary teams to actually both build the AI models and also understand how exactly the entire process from collecting the data sets to implementing the AI model in practice works. From there, I started working with a lot of startups, helping them out with validating their models, what works, what does not. And finally, currently, I lead my own lab at Ashoka University at the Koita Center for Digital Health, where we work with physicians, clinicians, medical students all across the country to develop as well as validate AI tools, which are being developed in India as well as abroad.
Superb, yeah. Very nice. Suvrankar, this is a question I ask from every AIMSonian I have on my podcast. Every time they say, when they are telling about their own journey in their life, they always give a great relevance to their institution, AIMS. So I'll ask you the question. It's the same question that I have asked everyone. What makes AIMS special?
I think if there was a one word answer to this, it would be culture. AIMS allows you to pursue whatever you actually want. When I joined my department in AIMS, I was very skeptical whether I can tell my guide that I want to do a project in AI because it was something which nobody had done. When I talked with him, he decided to take a bet on me and he told, sure, Suvrankar, let's go and try this. Even if it fails, it's fine. But if we can do it, actually becomes phenomenal, right? And if AI development has to happen from doctors in India, it should happen starting from AIMS, right? So yeah, AIMS gave me a lot of free hand to work with institutions which are doing good AI research. And being in AIMS also gives you the ability to leverage the brand to establish partnerships with really high quality researchers who are in this field. Plus, we get to look at a diverse set of conditions which are affecting patients from all across the country. So a lot of these conditions are often not seen in the state colleges in different places, right? But we do get to see these conditions and the diversity, the broadness of whatever we are seeing at AIMS. I think that actually shapes each and every AIMSonian who is in the campus.
AIMS provides you wings and gives you stars as a target, and each person in AIMS helps you achieve that. I think that's what makes AIMS special. True. So Suvankar, let's talk about AI now. Healthcare and AI. Two fields which, people could never imagine that one day AI could get into this field of healthcare. People in India, especially, including me, I would say that I always thought, okay, how can an AI replace a doctor? How can you have to communicate with that patient. And an AI cannot replace a doctor. That was my mindset 5 years ago. But today, what is the condition like? How is healthcare and AI related?
Right. So if we talk about the implementation level, I think we are far away from actually replacing doctors. The AI tools which are out in the industry and public today, they are not better than most of the experienced and expert doctors which we have. Where it does help is in a lot of these repetitive tasks which does not require a lot of cognitive abilities from a clinician. That is being implemented even in India. We are seeing AI scribes which are helping doctors make the documentation faster. We are seeing an even broader AI adoption in the medical coding part, in the insurance disbursal part, claims, fraud detection. But this is just the beginning.
Let's go to the basics. All right, we have been talking about a very technical detail of AI, but assume I am a layman, assume I am an MBBS first year fresher student. Explain everything about AI to me.
Right. So AI, you can think of as a tool which essentially helps you analyze lots of data and gives a certain output to you in a way in which you can use that output to either treat your patient or make a diagnosis or in any part of the regular healthcare journey in which you are seeing a patient and giving them a treatment. AI will be the go-to tool for you whenever you want to analyze data or extract analytics from a database which is not possible for a human mind to adequately sift through and come to a conclusion. It's not possible for you to know everything and anything about all cardiology diseases as a final year MBBS student. But an AI has seen all the papers, it has read all the books, and it can present to you just the key things which is relevant for you for that particular patient. After that, you use your clinical skills and expertise to figure out how you want to treat that patient with all this knowledge which the AI has distilled for you and given it to you.
Now let's suppose a MBBS student wants to learn, with a zero clinical AI background, he or she wants to learn everything about AI. So give me a 5-step roadmap how to learn about AI.
Right. First thing is awareness. You have to be aware of how and where AI can be used in your journey. AI is going to be at every step. The moment you are even starting to read your books, you can use AI. You can use AI for converting your books to video podcasts. You can use your AI to convert it into audio podcasts. So once you know what works the best for you, you can convert your books and reading materials to that modality and use that for your learning. It can create question answers for you. It can create mock tests for you. And it will help you in your learning journey as an MBBS student. When you go to the clinics, AI helps you in not missing certain clinical history, which you might miss. It helps you not miss certain diagnosis, which you might miss. It essentially helps you in picking up a lot of things, which ultimately helps you in becoming a better clinician and a better doctor. So this is awareness. Second thing is literacy. What are the limitations of the current tools? Today, you might go to the ward, you might use ChatGPT for finding a diagnosis, but it is not the best tool for you for finding or coming to differential diagnosis. There are other tools out there. So as a doctor, you should be literate enough to know which tools work the best for which case. There are different tools like open evidence for differential diagnosis. There are different tools for creating discharge summaries or summaries of cases. So once you're aware of the limitations of the current tools and which are the best, you become AI literate. This is something which is the baseline expectation for all doctors in the next couple of years. The third stage is wherein you actually start doing research in AI. So if you are like really interested in AI, you would test out multiple tools. You will see what tools work best in which particular setup. And then you publish your findings. This AI tools works best in this, so you can use it for this purpose. This is where you become an AI researcher. Then the fourth and final steps are, if you typically want a career in AI, is you start developing. You work with AI researchers, you work with engineers to develop the AI tools which solve some purpose. It can be in your clinic, it can be in your diagnostic center, which helps you do your work in an easier way. So you are not just using the tools, you are co-developing them with the AI scientists. And fifth is when you start developing AI tools on your own. We are yet to see that in India, but in the US, a lot of the startups in the AI field in healthcare are by people who have both engineering as well as medical background. So these newer courses are being started by IIT Madras, IIT Delhi, wherein they're training in both MBBS as well as in engineering curriculum. So these help you in creating tools yourself. So we are still a lot farther away from being there. But I think those are the scientists who will be actually building the next generation of AI tools in the years to come.
Which tools do you suggest that MBBS students should use in their college days?
So let's take first year, something which everyone reads. There is an anatomy book called BD Chaurasia, right? Typically, what we do is we stay in hostels, have fun for most of the time, and before exams, we start cramming them up. So we have set of questions. Essentially, ChatGPT knows about BD Chaurasia. It is already fed. You can, at the last day of your preparation before the exam, if you're just starting to read the book, you might probably have a difficulty in going through the entire book and remembering everything. You can just feed those questions to ChatGPT, ask it to create answers, quoting your book, and then it creates it in a way which is very short, which you can reproduce in the exam, and it also follows the book in which you want it to. This is something people are actually using. Similarly, another interesting area, and this, I won't think it's cheating or something, but even your teachers are using ChatGPT and Claude for giving questions. A lot of the times, the questions are made by residents for the faculty, and they just give it to ChatGPT that these are the topics for the exams. Make us some questions in this style. So you can always ask ChatGPT to create 50, 60 questions for you, and you might end up finding like 10 or 20 questions from that list coming in your exam.
How do you think is the prediction ability of ChatGPT? Because some students of mine gave me this example where they said that they basically uploaded last 5-year questions of their university and asked ChatGPT to give a prediction that what will be the next exam like. And it actually got almost 60% questions right. So do you think this kind also works?
I think the ability of AI to process data is much higher than human abilities. See, even if you look at teachers, right? They also do predictions. And often, many a times, they predict correctly, this is going to come. This is typically because ultimately, these are human beings who are creating the pool of questions. And every year, they select from that pool. Once you see the last 10 years questions and last 5 years questions, and you see the trend in how it's coming up, right? So AI tools, they actually are able to predict what might be the trend so that next exam, what are the questions which are going to come. Interestingly, this is something which is being researched a lot, and there is a benchmark called Future Bench, in which you give certain scenarios today, what is going to happen in the next 6 months. You might ask who is going to win this election, who is going to win this particular World Cup, right? And then the results come in after that event happens. So if I am asking who is going to win the next F1 race, we ask it to all the different tools, ChatGPT, Claude, Gemini, and then they will give their answers. We log them in, and we look at this back once the actual event has happened, right? So this is coming up in a very big way. Prediction is one of the holy grails which all AI researchers are working on. They will keep on becoming better and better. And I think the ability will keep on increasing as more AI agents start getting involved, not only in helping students figure out the questions, but also in helping the examiners and the question setters figure out the questions which they should be putting. So this is a very interesting future which we are seeing. And once we start relying on AI agents a lot, I think they will keep on becoming better at understanding what the other agent will be doing.
So give me a list of other tools that should be used during MBBS.
The most common one is ChatGPT, which everyone uses. Apart from that, especially for writing really good essays, you can use Anthropic's Claude. If you want to use a higher level of understanding and you want to use a free AI tool, Gemini 2.5 Pro is amazing, which is from Google and is available for all students across the country for free. Alongside, if you really want to have citations, so if you want to know which paper is being cited for giving a particular answer, Perplexity is an amazing tool. It gives you the exact references from where they are giving the answer to your question. These are the four basic tools which we use. We typically avoid using DeepSeek, but it does very well in calculations. So not so much in the medical field, but more in the mathematics field. If you look at research, then there are specific tools like BioOmni, Storm from Stanford, and Alan, which helps you write in very good research papers along with citations. So these are the few tools which you can start playing around with. Almost all are free. And once you gain the expertise, you can start looking at other tools.
I've heard that China is teaching AI to 6-year-olds. Do you think AI should be a part of the medical curriculum as well?
I think AI should be a part of the pre-medical curriculum as well. In India, typically, we have seen that the traditional medical curriculum lags behind a bit. But I think it's high time we need to start teaching about AI to the medical students, because AI literacy is going to play a huge role in the next couple of years. Unless we create doctors and clinicians who are aware of where AI works best and where AI does not work, we will be falling behind. So definitely AI has to be a part. In fact, Maharashtra University of Health Sciences, they have started a digital health program wherein they teach a little bit of AI, but I think the scope needs to increase and go to all across the country.
So, Suvrankar, which are the top resources that you would recommend to our audience, how they can learn AI, and the best resources to learn AI from?
Right. To start with, I think you can go to YouTube. YouTube has a whole lot of spectrum of AI videos which can help you start off with. 3 channels which I feel you should definitely look at when you start in your AI journey. Number 1 is the Medical Futurist. It helps you be aware of how technology and AI is affecting the field and where you can fit in. Second is a channel called 100x Engineers, wherein they teach various things about AI to you in a very layman term, which makes you much more literate about how these AI tools can be used. And finally, if you want to go a little bit more deeper to understand the concepts behind AI, you can look at a channel called 3 Blue 1 Brown, which makes you understand the complicated mathematics and fundamentals behind AI in a very nice animated way. So these 3 are your go-to channels.
Perfect. Thank you so much. Let's talk about career growth here. Which branches do you think, top 5 branches, which will have the maximum impact, the positive impact of AI on them in the next 10 years?
I think medicine is going to boom significantly. The reason being, as we give these AI tools in the community, we will be able to get more patients whom we can diagnose. Preventive healthcare is going to come up in a big way. So more patients get diagnosed early, and we are able to cater to a large number of patients. So all the medical fields, cardiology, neurology, the diseases which were previously not really coming to our clinics, they will start coming. Along with that, there's a contrarian view. Radiology is going to take a turn towards preventive radiology. We are already seeing whole body MRI scans, preventive ultrasound scans being done. So more and more people are gradually wanting to do more than just their comprehensive blood tests. They want to do their whole body MRIs. They want to do low dose CT scans and preventive ultrasound scans. So we are going to see a growth in preventive radiology in that aspect. Along with that, surgical specialties will be immune to AI for a significantly long time. The reason being, autonomous robots are not yet coming anytime soon in surgery. And the number of cases which we are going to see because of overdiagnosis and increased number of diagnosis is going to increase. And people will be more interested in getting even smaller tumors or incidental tumors in your body out through surgery.
What do you think? 3 new jobs that will be created because of AI in hospitals.
First of all is the chief AI officer. We are already seeing in really large corporations. Previously, there used to be CIOs. Now they are having CTOs. So hospitals having chief technology officers is happening already. And in the next couple of years, we are going to see chief AI officers, wherein clinicians with AI knowledge and literacy will be employed by them to decide which AI tools to use. Along with that, we are also going to see a different kind of expertise which hospitals are going to look at. These will be the operations people. In hospitals, major amount of time goes into ensuring that the patient queues and the patient billing and the patient claims disbursals happen on time. This will be significantly impacted by AI. So AI operations is going to come up in a very strong way, in which you use these AI tools for making your discharges faster, getting your turnaround time much more quicker. And essentially, we are also going to look at AI educators, because a lot of the hospitals will have a huge amount of people who are going to join the workforce without adequate AI literacy. So to train them in the different AI tools which the hospital is using, where to use them and not, they will need specific AI educators who are going to train this next generation of doctors they're employing.
Radiology, I'll still, dive deep into it. You have said that radiology will have a different impact. But right now, most radiologists are, in their heart are still scared that in the upcoming times, yes, there will be a time when AI will replace radiologists. Do you think this statement holds any value in the base of conventional radiology and not preventive radiology?
I think at the end of the day, what we are seeing in the field is that AI is getting smarter and smarter. Definitely, AI will be able to pick up findings better than human radiologists. There is no doubt about that, and we are already seeing that. But at the end of the day, you need to have a legal liability on a human being. You cannot have a legal liability on an AI tool. So the AI outputs will definitely still need to be validated by a human being. And that is where a radiologist who was previously able to do 20, 30 scans in a day, now the AI tools will create the reports for 100 scans. He will not need to scroll through the images and write the report. He will scroll through the imaging and validate the report which is being done and sign them off. So this is where the role of the radiologist is going to change.
So we'll also do an example here. Basically, we actually got an ultrasound from Google. All right, we put that on ChatGPT and we did a simple example and we said that act as a radiology assistant, guys. This is the thing that we are talking about. So act as a radiology assistant. I'm uploading an ultrasound scan. Describe the key anatomical structure you can see. List any obvious abnormalities or notable findings. Suggest 2 or 3 brief possible differential diagnosis, and add a short note on limits of interpreting a single image while advising correlation with clinical data. Now, this is the answer that ChatGPT has given. So, you can take the phone and you can check if it holds any merit or not.
So it has essentially told us that there are no obvious abnormalities which are seen. However, it has assumed the clinical symptoms and given 3 possible differentials which has to be looked into. It has quite correctly noted that this is an interpretation limitation because you have provided only one single image. To a layman, this will actually look like a very good report. But if you look at from a radiologist perspective, there are multiple limitations here. Even when you see a single image, there are a lot of other things which we typically look at. And usually we do not interpret images based on one single scan, right? So we actually see the entire video and do our interpretation. We are still not at that phase wherein in ultrasound we can upload these full videos to ChatGPT and it is able to diagnose this. Maybe someday we'll reach there. But apart from ultrasounds for X-rays and CT scans, a lot of the work actually can be done by tools like ChatGPT, and even better by tools like Radiology GPT, which can do the diagnosis much better. So yeah.
So in a way, is the answer yes, that radiologists are in a trouble in the future?
I think radiologists who are not using AI are in trouble in the future.
Do you think there will be a big salary difference also between radiologists using AI in the future and radiologists not using AI in the future?
I think radiologists not using AI in the future is just not going to happen, because essentially everyone will be using AI. AI is like electricity now. Anyone who is not using AI will become obsolete. So everybody will have to use AI. They will be able to do the scans and report the scans in a much more efficient manner, which will help us in turn cater to the large number of imaging increase which the world is going to see.
I'll ask you another question here. So we were talking about the jobs that were put for medical professionals moving into the field of AI. I saw that you mentioned that medical AI prompt engineer. Now this is one of the most effective fields. How do you think a medico can enter into this particular specialization? I won't call it a specialization. Let's call it a field.
Prompt engineering is going to be one of the most important skill sets for anyone, be it in medicine or any field where you're interacting with an AI agent. You need to understand how to instruct your AI agent so that you can get the best output out from it. Even today, most people do not understand how to prompt. There are certain prompting guidelines. So if you look at the general models which have been out there, like GPT-4 from OpenAI or Claude, Sonnet, these models have a specific structure in which you prompt. First is to tell the AI agent what role it has. So once you mention that you are a radiology assistant or you are a radiologist, immediately the data which it uses to give your output is specific to radiology. Then comes the role in which you are supposed to do, what task you are supposed to do, and what are the instructions you are supposed to follow to give the output. There are different kinds of prompt engineering techniques like chain of thought, reasoning, reflection. These are things which typically people are picking up gradually as they use these tools, but definitely there are structured articles and structured ways of prompting, which once you become an expert in, you can get much more out of your AI tool than someone who does not understand prompt engineering.
And what do you think will be the salary of a medical AI, prompt engineer in the current field in an upcoming 10 years?
I think everybody will have to become prompt engineers. So all medical students, any professional who is in the field currently, are going to be trained in how to make the prompts as long as they're using AI tools. Like I told you, all doctors will be using AI tools. So everybody has to become a prompt engineer. So I don't think there is a separate group of people called prompt engineering doctors which is going to exist.
If you ask me, in my personal opinion, I do not think that India will be AI ready in the next 10 years. I mean, if you look around, the masses are still playing with books right now. Where do you think AI actually comes in? We go to ChatGPT when we have to ask something. That's it. It's all about getting an update. We are replacing Google with ChatGPT. That's
Right.
it. We are not using it on a daily basis. And if you just think about going to MBBS and MD days, with even in MBBS, if you think about final year, you are having your morning classes, your evening postings, little time for yourself, preparing for NEET-PG. Where do you think there is time to learn, implement AI in your life? As on a daily base work, replacing something just for the fun of it is not something which I'm going to consider. But considering the fact that maybe, me and you could sit here with our digital avatar and do this kind of podcast, we're not thinking that we're still coming here, because I think AI is still very far away from the lives that we are living.
I completely agree with you. In fact, a major reason why it's happening is that change is a very difficult thing. And especially when you have to invest your time in learning something new, using some new tool, it actually takes up a lot of your own personal time, which hardly people have when they are doing medicine, even as a student and more so as a resident.
What would your advice be to a new NEET-PG rank 1 thinking about choosing radiology?
I think I have given my opinions on Twitter and it has always changed. So initially, if you look at my outlook 2 years back, I had told everyone, don't take radiology. It is going to be affected by AI. In fact, one person changed from radiology to doing medicine in Gujarat. He texted me also. But right now, as I'm seeing the field mature, and we are seeing that new avenues are opening up. Preventive radiology was not even a thing 2 years back. Clinical radiology was not even a thing a few years back. People were more interested कि diagnostic तो जा रहा है, we will do interventional radiology, which has hardly 100, 200 seats, right? So what happens to the 2,800 other people who are not doing intervention? I think the role of radiologists is going to change. And currently, I am much more bullish about radiology than being a little bit dismissive of the branch as I was 2 years back. Because I'm seeing the scope opening up and the bigger corporates and bigger institutes starting to do comprehensive ultrasound scans, whole body scans, which will only increase the workload and the ability of radiologists to increase their scope of work. And this is where AI will be significantly helpful. And I think this will also make them adopt AI faster, because without adopting AI, it's almost impossible to address the workload which we are going to face in the next 10 years.
Which branch do you think in the upcoming 10 years will lose the maximum number of residency seats because of AI?
I think we have been increasing residency seats at a steady rate. What we believe, and there are multiple schools of thought, is that the medical branches and the diagnostic branches probably will not need as many people as we are training right now. So currently, if you take radiology, there are 25,000 radiologists currently. We are extremely understaffed and every places. Once AI comes in, even when the scope of work increases, the number of scans increases, they will make us more efficient. So probably the number of radiologists which we have currently and the number of seats which we have currently will be more than enough for catering to that workload. And the need for increasing the seats continuously, that will decrease. This is going to happen for medicine as well. Not in the next 5-10 years, but once we start having agents interacting with agents, in the sense that today you are a patient, right? You are having your own smartwatch, you are having your own ring, which is tracking your parameters. It's not possible for, as a doctor, for me to analyze those and give you a personalized treatment plan. But this thing can be done by AI. So 10 years later, when you go to the doctor, you will have your phone, which captures all your parameters. It transfers that data to the doctor's AI companion, who analyzes that and gives the doctor a digital twin of your persona. And the doctor is able to use that to give you better treatment outcomes. NSAID, which works for you, might not work that well for me. But how do we know that? But this information will always be there in your phone, because maybe you took paracetamol some point of time. Let's say you took Crocin and it did not work well for you. Maybe you increased the dose 650, it worked for you. Those parametric changes are recorded in your phone. Now when you go to the doctor, his agent analyzes that, and now he tells the doctor, don't give him the 500 dose Crocin, give him the higher dosage one, because that is what works for him. This is how the entire field is going to change. It's very difficult to predict whether AI efficiency will outperform the demand or whether the demand will outperform the efficiency. But that is what will decide whether we are understaffed or whether we have enough number of doctors to cater to the needs at that point of time.
Which branches do you think will remain human dependent more and more in the upcoming 10 years and will have the least impact of AI on them?
Surgical branches are going to definitely have a lot of immunity when we are looking at AI coming in. So if you look at the very specialized surgeries like neurosurgery, cardiovascular surgery, these will always require a human intervention, because it's a matter of life and death. We are seeing what is happening with even the very highly performant Airbuses and flights, right? AI will always make mistakes. At that point of time, a human has to be there to ensure that if the AI is making a mistake, he can quickly take over and help save the life of the patient whom he's treating. Surgical branches will definitely be the last branch in medicine to be affected by AI. We are seeing autonomous robots coming up. In fact, just last month, a very interesting study was published wherein they did a surgery autonomously on an animal and showed that without human intervention, they are being able to do that. But those are very simple surgeries. And typically, we know from animal studies to humans, it takes a lot of time. And when it's AI, it's a black box, right? You never know that some point of time it might choose to ligate a different artery than what was supposed to be done. So these are the branches which I personally feel will be affected the last. Diagnostic branches, as I mentioned, will be affected earlier, but at the same time, the scope for diagnosis will also be increased to a significant extent that we need not be worried about the job losses which are going to be there.
Boss, let's talk about AI entrepreneurship and practice management. Which three must-have tools do you recommend for small clinics and private practices?
Right. First is your patient billing and patient encounter tools. Today, if you go to any hospital or even your clinic, you will see huge queue of patients. There are lots of AI tools which can actually help you in predicting the time of waiting and letting your patient know so that they can come at that particular time. It leads to less amount of congestion in your waiting room, and you can ensure that your patient also is more satisfied कि उनको wait नहीं करना पड़ा. This is something which a lot of startups are using. See, at the end of the day, the tools are all the same. They are using GPT, Claude in a different way and wrapping it in and giving it to you. As a doctor, you can always create your own apps. There are tools like Replit and Lovable, in which you can just tell that I want a patient billing tool and a patient reception tool, wherein we can give a queue management nudge to the patient to come at a particular time. So these tools actually now create your complete apps for you. You just need to tell whether you want to use GPT in the backend or Claude in the backend, and you can give it to your patient that you use this tool. You will know when I am actually going to call you for your consultation. Number one. Second is scribes. Today, when you are talking to a patient, you actually spend a lot of time documenting the history, documenting the treatment plan, documenting your diagnostic tests. Scribes do it automatically in the background. Today, with the Indian language models coming up like Sarvam, and we work with them very closely, these tools actually can pick up doctor-patient conversations in any language of the country, wherever it is, in whichever dialect you want to do. So it automatically creates that, and you know the style of the doctor in which you write your prescription. It creates it in the background while you talk to your patient. So at the end of the day, once your conversation is done, you don't need to write or waste time doing that. You can just take a look at what was created, make a tick box, and send it off. It saves your time significantly. We are seeing studies where it saves like almost 5 minutes of encounter per patient, and that's a significant time save. The third one, which I feel is going to be very, very important and is already being solved all across, is discharge summary. Today, if you go to the IPDs, there's a huge amount of data which needs to be collated and entered into the discharge summary, which we give to the patient. I can tell you about what we did in one of the hospitals. It used to employ 7 different people for just creating the discharge summary. They were non-medically trained, but they used to just take into account all the records, just copy it, summarize it, and give to the doctor who is to sign it off. Now with AI tools, we are doing the discharge summary creation in 10 seconds. And you will not believe the amount of time we have saved. It's a 150x time which we are saving. The hospital at the end of the day does not need to pay those 7 people for creating discharge summaries. They just need to pay for the per record basis in which the discharge summary is done automatically. So this is one particular work which has shown ROI already to the hospitals. So these are there in India. These are there in US. So I think these three particular tasks will be the first one to be impacted, and then gradually the entire workflow starts getting impacted by AI.
Which three AI-powered no-code sources you can recommend for medico entrepreneurs if they're planning to build something?
Right. For application building, I personally use Lovable for building any app. And another tool which is very useful is something called as Replit. So you can even download Replit on your phone. You can ask Replit agent to create an app for you, and you can go to your washroom or for your coffee or your gym. Once you come back, it automatically has that app ready for you. You just need to tell certain changes which you want in that. It does it for you. The third one, which is becoming more and more important with multi-agent frameworks coming, is called NI10. So it helps you create a workflow. You tell that I want 5 different agents to do this work. I want this agent to talk to my patient. I want this agent to look at the history of the patient and give me the differential diagnosis. And I want the final agent to create a summary, right? So NI10 allows you to employ all these tools one after another and create a complete workflow which can go into your app which you have made through Lovable or Replit.
So, Suvrankar, let's talk about the negatives of AI. We have seen people relying on ChatGPT so much that Sam Altman has also said the same thing, that do not blindly trust ChatGPT. It also makes mistakes. So, what do you think can happen if all the doctors blindly start following AI? If tomorrow a patient goes through mortality, who do you think the government will blame? The doctor or the AI?
Right. I think it's a very important topic which needs to be addressed. AI will always hallucinate. It's not a bug, it's a feature of AI. The reason why it is able to predict something is the same reason why it hallucinates. As doctors, ultimately there is no substitution for the knowledge which we have. Any output which AI gives has to be vetted by a doctor. Till date, there is no legislation anywhere in the world which tells that the AI is responsible for a wrong diagnosis or a wrong output. It will always be you at the end of the day. So as a doctor, it's your responsibility. If you are not sure of some output which an AI is giving, you should go back and read that particular article from where that particular output has come, and then use your skills and training to vet that before you actually give that plan to a patient. At the end of the day, it is always going to be the doctors who are liable, and it is not going to change at least for the next 10-20 years for sure.
Do you think AI can handle empathy or the ability to, communicate sensitive, delicate information to the patients?
If you had asked me this question 5 years back, probably we would be telling you that no, empathy is something which doctors or human beings would be far better than AI. Today, it's not the case. We are seeing the tools coming out from Google, and these are publications in Nature and Lancet, that has shown that AI agents are now showing more empathy. What they did was, they did a study in which they blinded the patients, they made few human actors, and they made few AI agent actors. The patients found that the conversation with the AI agents were more empathetic than the human doctors. So I think this is where doctors need to up their game, because if we start losing that human element in the conversation which we're having with the patient, then it makes us being replaced by AI much more easier and faster. So I think what is going to happen is, we are going to rely on AI for a lot of the repetitive tasks, non-cognitive tasks, so that it frees our time and we are able to spend more time with our patients. And that is where we will start becoming more empathetic, because we have time to spend with the patient, listen to them. Every patient has a story, right? They're not just a patient for you. They have a story behind them, how they were diagnosed, how they came to your clinic. Once we start understanding them and giving our management according to how the best outcome for the patient is going to be, I think that is where the final human AI collaboration is going to play out in healthcare.
Last question of the podcast before we move to the rapid fire, and this is a major one. Right now, we have 4 superheroes in the AI section. We have the ChatGPT, we have Gemini, we have DeepSeek, we have Grok. All right. If you have to rate all of these based on the use cases for clinicians, how will you rate them?
Number 1 would be Claude. for most of our documentation and clinical summarization tasks. Second would be Gemini 2.5 Pro. This is the best for differential diagnosis at this point of time because Google has trained them on medicine data. Third would be ChatGPT for most of the other tasks wherein you are dependent on workflow optimization. And finally, Grok, because it still has to do a lot of improvement on medical data.
Thank you so much, Dr. Suvrankar. I believe today we have learned a lot about AI, but we are not going to end right now. We have moved to the rapid fire. So I'll put some very quirky questions for you. So they are very two simple rules for the whole game. You have to be super spontaneous and you can't look at ChatGPT. So let's start. Top 3 apps on your home screen right now.
OpenAI, ChatGPT, Anthropic Claude, Replit.
How many hours of your day goes into AI?
10 hours.
Who is the Elon Musk of health AI in your eyes?
No one yet.
No one yet. Do you think can be the Elon Musk here?
I really don't see anyone doing anything in healthcare.
Do you see yourself as a person?
I do aspire to be, but let's see.
If you could change the world in some way, what way that would be?
I would want healthcare AI to be accessible to each and every person on the earth so that we can diagnose them earlier and treat them earlier.
Let's suppose you are the PM of a country. You have to do something, a single task, which could actually change the way the country looks to AI. What would that task be?
I would give AI access in their own language to each and every citizen of my country.
Your biggest phobia?
AI replacing radiologists.
Is that why you have shifted from radiologist to a AI? What do you call yourself right now?
So I'm an AI researcher.
AI researcher.
Yeah. Not the phobia, but yes, I think that might have played some small role in my decision.
So I would call that a very futuristic move that you have taken. Were you scared when you did that?
Not really. I think I had great support, and also this is the time to take the bet on AI. I think this is the right time.
What's the coolest thing you have done with AI this week?
I wrote an entire scientific research draft using AI.
One skill you are currently trying to master.
I think I'm trying to up my Python programming skills currently.
So do you think that you are in love with coding more than an MRI machine?
Not yet, but maybe soon.
All right. Thank you so much, Dr. Suvrankar.
Thank you.
It was a very great podcast, a very insightful discussion, and we got to learn so much about AI today. Thank you so much for that.
Thank you for having me, and we'll talk to you soon.
Thank you, guys. Thank you so much for watching today's podcast. I believe AI, artificial intelligence, the one thing we were all scared of, we have learned everything about it, how it is going to impact us today, tomorrow, in the coming 10 years. It's going to be great. The only thing that we need to be worried about, how we are going to be in the best possible relationship with it. So start your AI journey today. Be the best in it and be the doctor AI cannot replace. Be the doctor who has AI as its best friend. Thank you so much. And before you go, do not forget to like, share and subscribe. And who should be the next guest? Put that in the comment section. Thank you so much and be AI ready. All the best.